Good afternoon, mayors, ladies and gentlemen. Welcome to our 12th Livable Cities Lab, brought to you in partnership with the League of Cities and Globe Telecom. The COVID pandemic has placed great stress on our public health systems in our cities. In this regard, our third Livable Cities Lab for this year will focus on resilient public health systems. Our discussion will revolve around how cities and institutions address the challenge of maintaining a responsive healthcare system. The solutions that we implement to recover from this pandemic will define our new normal. If we build resilient public health systems, we can build an equitable and inclusive society and a stronger economy. We are pleased to announce that Mayor Vico Sotto of Pasig will speak about the Pasig Experience in managing COVID. He will also be joined by former Secretary of Health, Dr. Manuel Dayrit, who will discuss strengthening the public health system in cities, and Health Undersecretary Leopoldo Vega, who will represent the One Hospital Command System. Thank you, and we look forward to your participation in today's event. I turn over now to Sui Suarez to discuss some house rules and safety reminders. Sui is one of the co-founders and core team members of Livable Cities Challenge Philippines. He is an energy industry professional with 25 years of experience in communications, corporate social responsibility, commercial oil products businesses, and project management at Shell. His most recent roles were in corporate external relations for Shell International, where he led the global communications campaign on the future of energy, and in the Shell scenario team, where he managed external phasing activities and channels. Sui holds an industrial engineering degree from the University of the Philippines and studied cities and climate change at the London School of Economics. Let's all welcome Sui Suarez, our moderator for today. The floor is yours, Sui.
Thank you, Bill, for the kind introduction. Welcome, everyone, to the Livable Cities Philippines webinar on resilient public health systems. Before we begin, let's review a few basic safety reminders for all our webinar guests. First, be aware of our surroundings while the webinar is ongoing, in case you need to stop due to an emergency. And second, please always stay safe and practice social distancing if you are out of your home. We would like to acknowledge the mayors who are joining us today in this webinar. A lot of them are in the audience. We have Mayor Brian Celeste from Alaminos City, Andrea Henares from Antipolo City, a regular webinar guest, Mayor Lani Revilla from Bacoor City, Mayor Nicolas Yulo from Bago City, City Jalia Hataman from Isabela City, Mayor Catalino Adapon from the municipality of Josefina, Mayor Rowena Tuazon from Masbate City, our former webinar speaker, Mayor Richard Gomez from Ormoc City, Mayor Caridad Clasio from the municipality of Quezon, Mayor Hermenegildo Gualberto from San Fernando City, Mayor Delio Lood from the municipality of Sinacaban, Mayor Crisel Lagman from Tabaco City, and Mayor Juan Carlo Medina from Vigan City. Mayors, welcome to our webinar this afternoon, and thank you for spending your time with us today. Here are a few more administrative reminders. No? This webinar is being recorded, and a link to the recording will be sent to you after this session. Second, if you have questions, you can ask this through the Q&A chat box in Zoom. I'd like to point out that there is a feature where you can vote for a question by clicking on the thumbs up button icon, so that the most voted question comes up on top of our priority list of questions. So some of these will be answered directly by our speakers or their staff in the chat box, but otherwise we may park these so that we can take this up later in the open forum. Third, at the end of the webinar, we invite you to please fill up our feedback survey, because your response will help us improve our Livable Cities Lab series. And you may also get a certificate of participation by answering the corresponding question in the survey. So currently, we have, in Zoom, we have 245 people who are joining us on our webinar. And we have a few more in our Facebook Live. So thank you again for spending your afternoon with us in this Livable Cities Lab. Before we get started, I'd like to put a poll question out to the audience so that we can get a feel of our audience. So the first question is, where are you joining us from? No? If you could answer, click one of those four buttons to let us know where you are right now and where you are joining us as we are holding this webinar. Okay? Just click on the submit button and then we're going to see kung nasaan tayo ngayong hapon. No? About 40% from Metro Manila, a third from the rest of Luzon, and then almost equally split, no? 14 and 18% from Visayas and Mindanao. One more poll question, please, if I can just ask you one more question, and this is, are you satisfied, or how satisfied are you or about the public health system in your city or municipality? You see that about 44% says needs improvement, not satisfied, about a third are satisfied, and extremely satisfied. So, okay, good. I think that's good to know because that is the topic of our webinar this afternoon. As we will kick this off by introducing, naturally, we'll introduce our first speaker. And it is Dr. Manuel Dayrit. No? Sir Manuel has been a public health practitioner for 45 years. He started his career as a community physician in Davao del Norte. He has worked in the public, private, NGO, and international sectors, as well as in the academia. As one of our country's leading epidemiologists, he is active in COVID-19 control efforts through private sector engagement with national government and local government units. Over his professional life and various engagements, Dr. Dayrit has seen the evolution of the country's health system. He has been involved in many of the Department of Health's phases of reform and organizational development from the 1970s to the present. He was a director of the Department of Health when the Department of Health transitioned from martial law during the Cory Aquino years. He was an assistant secretary when the DOH bureaucracy was decentralized in 1992. As health minister from 2001 to 2005, he led the DOH in the suppression of SARS. In 2003, he earned the title of SARS Czar. Under his leadership, the DOH was recognized for its effective implementation of disease control programs, including for dengue, tuberculosis, and vaccine-derived polio, among others. During his term, the Department of Health widened the use of low-cost generic medicines, as well as increased access to social insurance by indigents. In recognition for his accomplishment, DOH was cited among the top-performing government agencies in social surveys and by the Makati Business Club. It also gained citations for its efforts to curb corruption in the organization. Sir Manuel is not new to the Liveable Cities Lab. Since he did a great job moderating a panel of mayors in our March 30 webinar entitled Vaccine Ready Cities, the Road to 500,000 Daily Vaccinations. So ladies and gentlemen, please let us welcome back to Liveable Cities Lab, our first speaker, Dr. Manuel Dayrit. Sir Manuel, magandang hapon. How are you?
Magandang hapon, Suwi, and magandang hapon to everyone, particularly the mayors who are here. I'm very happy to see your names, and I know quite a number of you personally, so I send you my best wishes. Thank you for Liveable Cities for this opportunity to speak. Well, this is what I'm going to talk about. It may be theoretical, but a lot of this actually came from experiences, and so I'm just bringing up the experiences to a level of theory. And I'm sure many of the mayors know of these issues already. So part one, I'm going to talk about the health system, maybe from a city perspective, and actually talk about the components of a health system. And then in part two, try to talk about the city's response to COVID-19, and maybe try to benchmark also with other countries. I wanted to begin with this slide. Nakikita ba ninyo? This is essentially the enemy. This is the virus, okay? And this is actually a picture of the virus in a petri dish in lung cells. And if you see it, okay, the purple covered here, if you follow my cursor, Those are the lung cells, yung purple. And then close up niyan, these are the cilia. These are the hair-like cells that line, the respiratory tract. Itong green stuff niyan, that's actually mucus. And then the red dots, that's all COVID. That's the virus. And this is an electron microscopy of, so many thousand magnification. Now, I bring this up because in the Petri dish, if you see this text on the right, they were able to witness virus explode from 1,000 particles to about 10 million in just a couple of days. Ganyan ka-exponential ang growth ng COVID. And therefore, as I will discuss it going forward, it is not an easy enemy to overcome. So if you think of the enemy as COVID and you think of it as a shock, okay, this is a picture of resilience of a system, okay. On the y-axis, you see the capacity of a system. Think of this as a city, okay. Think of it as a city, a capacity of the city, a public health capacity, for example, which could be above normal or could be as low or low. The first question, that was the second question in our referendum this afternoon. Okay. Some of the cities actually have normal capacity. If you're very satisfied with it, maybe you have above average capacity. But come now, COVID, and that's the shock. And it hits your health system. And because of that shock, your performance is going to drop. And depending on where you are in terms of your original capacity, it could drop very low or not so low. But as you can see, that drop, okay, is pictured here. If you think of COVID-19 as the risk, okay, or the hazard, yung exposure niya, ang vulnerability of the people, the hazards associated with it, that actually accounts for the total shock. Now see how the system recovers. The bold line will show the system drops, and I'm sure you can describe in your cities how your system dropped, but was able to recover and hopefully recover to a pre-COVID state. How fast you were able to respond, maybe you can tell us later. But you can see that some systems recover very, very quickly, and may even recover far better than they were. What we would really like our system to be is to recover and maybe transform itself. Meaning to say, don't let a good crisis go to waste. Transform your system if there's an opportunity to do so. And then, there may have been systems that totally collapsed. Good thing yung ating sistema didn't collapse, at least, as a country. But you could see that in other countries, their system could have totally collapsed. And therefore, when we think about pandemic or public health systems that are resilient, this is what we're talking about. What is the capacity of your city to jump back? And there are a number of factors that will actually determine that. And therefore, if you think of, for example, any unit or any government, okay, any institution that might have different capacities, in this case here, capacity, energy, okay, infrastructure, food, the whole capacity of that entity. If you're working in silos, it's not going to work. And therefore, this shows that you have to synergize everything and bring together your knowledge, particularly cultural knowledge within your own cities and your own provinces, the social competence, that means really, how, the society in your province or in your city responds, how competent is it? Public, private, NGOs, and then the technical excellence that you have. All of these have to come together if you're going to go towards that livable city that we're actually envisioning. So with that, just to keep in mind that we're serving people, protecting people is what this is all about. And I just have a picture here that it's a very varied demographic of people, living in different contexts, very highly urbanized, maybe not as urbanized, very rural areas. You have to protect your health workers, you have to protect your elderly, you have to protect your children, you have to protect your adults. So how does a city actually, how is it able to do that? And not only for COVID, but for all of the non-COVID concerns that continue to be important, even if COVID is the primary preoccupation at the moment. And therefore, when you think of this as a graphic of a health system. Okay, think of this as your city, mayors, okay, where you want health status of your population, few deaths, very few premature deaths, very few morbidities, protected, high trust satisfaction. How do you get there? Health status could include, COVID, but it could include a lot of non-COVID. Your chronic diseases, the state of your malnutrition among your children, okay, the state of chronic diseases in your area, just the state of good mental health of your population. In order to achieve these outcomes, your system has to, one, be able to create a service delivery mechanism for all types of services. That would include preventive services, so important, as well as your curative services. But in order to do that, you have to have your facilities, your hospitals, your health centers. Not everybody should be hospitalized. In fact, only a small proportion of your people get hospitalized. And if you are simply investing in your hospitals, you may be missing out on a lot of preventive care. Now, your service delivery has to be supported with very good financing. Raised from taxes, raised from social insurance, raised from contributions, grants, and also think about all of the inputs, aside from financing, from the people that man your health system, from the medicines and technology and consumables that are available, the knowledge that you have, the capabilities in technology, the capital, all of these input into your service delivery capacity. And in a sense, okay, all of this has to be managed properly, this oversight in terms of policy, but that has to be well informed by information and abetted by strategic partnerships and other things. So not only are there people within your city, there are providers, and they are both from the public and private sector, and even the church sector, and of course, the politicians and the policy makers. Many of you, this is where you are. And therefore, you have to think about the resiliency of this whole health system. If when COVID hit, your hospitals and your clinics were unprepared, and in many places they were unprepared, this is going to go down. So this is something to reflect on in terms of a system. The whole dynamic around this in a very, very simple graphic representation. Now, if we were to break that down, it boils down to a number of things. Our health system has to have harmony and built on, your staff. How well trained and motivated are they? Are there enough of them? If there are very few, they may be overburdened. They're not going to last very long. Do you have well-maintained infrastructure, well-maintained hospitals, clinics, labs, etc., etc.? That was the problem with COVID. You had to go and build isolation facilities. You maybe didn't even have a lab in your area, or you had very few. You had to have a reliable supply of medicines and technologies. When COVID hit, walang PPEs, walang medicines. You have to be backed up by adequate funding, and this is one of the problems when you can't sustain the funding. Brought together by health plans and policies based on good evidence and health information. and of course, this capacity to address your disaster. So these are the things that your health system has to have. So when COVID hit, at the outset, there was lack of clarity in governance. Okay, and I've heard it said that local governments felt, they were not properly supervised by the national government. You had to build capacities to test, trace, treat, even now to vaccinate. Data management, national data, often delayed, incomplete, now better, okay? But that was several months to a year in the making. Human resources for health, when COVID hit, many illnesses and deaths among them because they didn't have PPEs or they weren't even psychologically prepared that this virus was going to be lethal. Financing, the woes in PhilHealth, procurement of supplies, medicines, vaccines, we had problems there. Even now, vaccine supplies are unreliable as we go to the global market to purchase. Then, of course, you have to communicate to the public, restore public confidence, revive the economy, open public transport, and so on and so forth. I'm sure you can share a lot of these things during the open forum. So, even the best systems were overwhelmed by COVID. Let's talk about some examples. UK, they're having a surge now because of the India variant. But as you can see, they were able to get their act together and vaccinate. So now they're about 70%. But as they open up with the India variant coming in, they probably have to reconsider. Israel, a small country, 5 million. They were able to vaccinate immediately. Okay. But if you look at other countries here, Brazil, supposedly one of the better health systems, it's in total disarray. Australia did a very good job, and mainly that's because they stopped all travel going there, and they were very, very strict about entry of foreigners. Sweden, for example, didn't do very well. Many parts of Africa, now South Africa, in the midst of a surge. The US, the richest country in the world. So many cases. But they were able to bring out vaccines. India, for all its flair and speed in IT, they're suffering now. Singapore did very well, but now facing a surge. So when you think of all of these, to summarize it, the most proactive, integrated, organized responses were the ones that did very well, particularly at the outset. But it had to be maintained over time. And as you can see, countries that did very well and were able to contain it, including Singapore, Taiwan, even Vietnam, facing surges. And for example, if they didn't procure their vaccines early enough, they're having difficulty procuring from the global market. So this is just to show that the virus, with its exponential growth, the battle isn't ended yet. And we cannot underestimate the ability of this virus to grow exponentially, surge, mutate, cause illness and death. And therefore, from the point of view of a health system, our health system response must be equal to the viral threat. This is always what I'm trying to explain to people. Capable ba tayo? Tanong nila. I'll say, we're capable at this level, but if the viral threat or if the hazard exceeds our capacity, we could actually be overwhelmed. And so I just showed this. Structurally, it looks so neat on paper, no? But if you look at it, there are really no connecting lines between the reds, the blues, the greens, and the oranges. Essentially, we've created a system that devolved, and there's no administrative control there because of the local government code. And when the pandemic hit, essentially, DOH didn't really have the administrative handles. And therefore, this is something that we have to think about. How do you functionally integrate? Because I don't think you can go back in devolution. How can you create a system that's functionally integrated? Even if administratively, you may not have direct lines. These are things that we need to tackle going forward in redesigning a resilient system. Because certainly, there are some instances where you need a command and control system, and some instances where, a more autonomous running, particularly in the devolved units, is better. You need a combination of the two. And this is just to show that, well, in these NCR cities, the fight is to bring down your reproductive rate to less than 1. In all cities, this is just an example, Metro Manila, because I have data here. But wherever you are in any city or any province in the country, that's the fight, to bring negative growth for the virus. And this will show you that it's not that easy to do. You can see this is the epidemic curve. And we thought, this first peak was, we were controlling it. And then we had a huge surge, the second peak. That's going down. But again, it's rising again, which tells us that the battle isn't over yet. And therefore, we have to maintain the pandemic control functions of test, trace, treat, and we have to vaccinate very, very rapidly. And therefore, this is what it's all about. Protecting the vulnerable, minimizing deaths and illness, activating the safety nets. You know better than anyone about this, particularly since you had to govern around the distribution of the ayudas. Keeping essential economic services going in your cities. Nobody knows more than you about this. And protecting workers at the front line and sustaining supply chains, particularly in your cities. So resilient pandemic control in the city would include, among others, optimizing your current capacities and new capacities. So I guess moments of reflection on whether your capacities are actually strong enough in terms of all of those components that I already mentioned. Setting up laboratory facilities, for example, quarantine and isolation facilities, these all have to be there to be available. Tracing contacts, expanding critical care facilities, and vaccinating, particularly in the end, the vaccinating. Because I think this is where hope lies over long term. Now, examples of where we've done well, okay? And these are just, very few. I'm sure we would like to hear from you from good practices. But for example, in many cities in NCR, LGUs are rolling out the vaccination program very well, okay? Setting up vaccination sites, storage facilities, data systems, okay? I think they're showing the lead there. And we'd like to see all of this happening in the provinces as well. Collaboration between public and private sector to build capacity. I think this was another example of building better, and which we can continue post-pandemic. But this included for ramping up of testing, procurement of supplies. There was this whole collaboration because government couldn't do it by itself. And finally, setting up databases and dashboards to track the epidemic and now the vaccination program. So this will just show you, well, I'm sorry, this is NCR, but just to show you the number of confirmed cases, and you can see that, the bigger the population, the more cases there are, and therefore the smaller cities and municipalities have fewer cases. But I want to show you this because this is attack rate per 100,000. And whereas in San Juan, for example, you had only less than 10,000 cases compared to Quezon City of 100,000. When you look at a density or a concentration per 100,000, look at Quezon City, it's 3,000 per 100,000, but San Juan has 7,000 per 100,000. And therefore, it's also not just the absolute numbers of cases, it's also the cases per population. And you really want to have a low attack rate because that shows you that per head, you're actually managing the number of cases that occur. So I'm nearing the end of my presentation. Our goals for 2021 and beyond: minimize transmission, an effective vaccination program, return to positive economic growth, and transform our health system. That's really what we want to see, hopefully 2021 and beyond. But I show this slide because, particularly for people that don't want to be vaccinated, this is a very, very graphic picture, okay, of how the antibodies actually tie up, so to speak, the virus. It ties up its receptors so that it cannot enter the lung cell and infect it. And that's what vaccination does. And therefore, this is something that, people, it would be good for people to understand that this is the way it works graphically. And this is just one of the immune responses, the antibodies, because there are others, including the cells. I won't discuss that. But it's important for people to understand that, to let go of their fears for vaccination, because vaccine hesitancy is still very, very high in this country. So finally, top tips and takeaways. Let's learn from the governance lessons of the pandemic and modernize our health system. To do that, we have to invest wisely going forward. And not only at the national level, also at the local government level. We have to achieve excellence in governance and synergy between national and local governments. Okay, that we saw lacking, particularly at the beginning of the pandemic. Practice exemplary leadership among all sectors of government and society. It's not just the health sector, it's all of the other sectors. Because without this total approach, it's not going to work. And finally, educate and inspire the youth and the next generation of health workers. So thank you very much. I'll end there, and good day to everyone.
Thank you, Sir Manuel. It's very informative presentation. I was really quite interested in seeing a picture of the enemy, the scanning electron microscope photograph of what a coronavirus looks like. But also you showed also the solution, a picture or graphical representation of what an antibody looks like and what it does. So it's quite interesting. I really do take away what you mentioned when you said that never let a good crisis go to waste, which I just learned that it is attributed to Winston Churchill when the world was struggling after World War II, and eventually led to the formation of the United Nations. Great stuff from your presentation. Lots of takeaways there. Thank you for your talk.
Thank you.
Thank you, sir. Let's move on to our before we move on to our next speaker. And thanks to the people who have put in their questions in the Q&A box of Zoom. Thanks for that. Please keep the questions going, and if you can, vote them up, so that we'll know which ones to ask in our panel discussion later. Also, you can ask some questions in the comment section of the FB Live. In Zoom, we have more than 350 people on this Zoom webinar. Thank you for spending your afternoon with us. And there's about 30 plus people on FB Live. Magandang hapon po sa inyong lahat. Moving on, it's my pleasure to introduce our next speaker, no other than Undersecretary Leopoldo Vega. Usec Vega is currently the Undersecretary of the Department of Health, which spearheads the National Patient Navigation and Referral System Initiative. He is also a former Medical Center Chief of Southern Philippines from 2009 to 2019, and is a licensed thoracic cardiovascular surgeon. Ladies and gentlemen, let us welcome Usec Vega. Usec magandang hapon. How are you today?
Thank you, Sui. Thank you also for the very formal introduction. And I would like to greet all the mayors and, of course, my mentors, Dr. Manuel Dayrit, and all of the viewers and the participants in this Zoom. First, my talk will be on the resilient public health system and how it impacts on highly urbanized and livable cities. Allow me to share with you our experiences with the establishment of the One Hospital Command as a response of the Department of Health to the COVID-19 pandemic in managing the risk. Pandemics come and go in every decade, such as the HIV virus, Ebola, swine, bird flu, MERS-CoV, and SARS. But the greatest pandemic happened in 1918 for the Spanish flu. 50 million people died, most specifically in the second wave. Microbiology was still in an infancy stage. Viruses as pathogens were not recognized nor discovered. These were the limitations of science. In comparison, COVID-19 or the SARS-CoV was rapidly recognized and identified, and the whole world accelerated the development of a vaccine for a cure. The Philippines was not spared of this global crisis. COVID-19 or the plain virus found its way in many countries because of our global connectivity. We had our first wave of the pandemic last July, August of last year. And the second wave was much more nasty last April and May of this year. The experience of a surge in the hospital system paved the way for the establishment of the One Hospital Command Center for better coordination, better referral, and most distinctly, the allocation of appropriate beds by hospital facilities. There are many challenges highly urbanized cities will face in the advent of a disaster or pandemic. It cuts across 4 dimensions, namely the population, the social and urban infrastructure, and the healthcare system. It can be noted that ICT or information communication technology plays a big role in creating opportunities for possible solutions in managing or mitigating the risk. Metro Manila, as a mega city with an almost 14 million population and highly dense, with mostly level 1 and level 2 healthcare facilities, exposed our flaws and limitations in our healthcare capacity. According to the Asian Development Bank, they identified 5 pillars for a city to be livable. 1 is engagement. The second is economy. The third, environment. Fourth, equity. And fifth, enablers. These pillars are important to provide an appropriate support, especially to developing countries, which can be used as a reference on how to build a livable city, looking at the health sector as an important enabler that every citizen can access the existing healthcare facility. Using the previous framework of the ADB, we can note that there are different variables that can be strengthened to improve the health system's capacity. The first component is human resource. Health facilities must have the desired human resource complement to service specialty and subspecialty cases. This is a key component in addressing the initial onslaught of a pandemic. The second component is organizational capacity, which would include health facilities infrastructure, like critical care units, well-equipped emergency room, and surgical suites. This would also be an index of the readiness of the healthcare system. The third component is governance. And this is all about regulations, standard of care, clinical practice guidelines. This governs our implementing guidelines for our daily operations. And lastly, which is pivotal in providing resiliency and acting as an enabler, is ICT, or information communication technology, which provides interconnectivity for proper coordination and referral across all systems. The importance of ICT as a key component to resiliency and as an enabler in our healthcare facilities must be emphasized. Last July 2020, when the number of cases were increasing, we successfully established the launching of the One Hospital Command Center. Its main objectives were proper coordinated care across hospitals and facilities, and to strategize the increase in health capacity by allocating dedicated beds. Other government agencies, such as MMDA and BCDA, hosted and adopted us together with PCSO and DICT in our formative months. The private sectors, specifically T3, formed the nucleus of support. Tech companies such as Pureforce, Globe, Icon, Smart, and PLDT also provided the backbone of our communication network. This year, we had the second wave starting April, and the number of cases doubled compared last year. The health system in the NCR buckled down on the caseloads of patients needing immediate care. The One Hospital Command, similarly, was overwhelmed with the volume of calls and referrals. Our role was crucial and critical in managing the risks of a surge and high volume patient loads to health facilities. The One Hospital Command responded to this challenge by adjusting to the needs and offering more services. This meant we had to improve on our telecommunication system, improve our staffing, and upgrade our working facility. At this time, we were graciously accepted by the management of PICC, and this is where we are right now. This response or adaptation strategized the weaknesses we had at the start and provided the importance of resiliency to face the challenges. With almost 1 year of operation of the One Hospital Command, we saw its exponential growth. Lately, with the concurrence from the Executive Committee of the Department of Health, we submitted our proposed bill to the House of Representatives and the Senate to the institutionalization of the One Hospital Command with the following mandates: support and strengthen provincial and citywide healthcare provider network, coordinate between LGU and other healthcare facilities, development of inventory of HRH and existing healthcare services, interconnect and facilitate the communication between healthcare facilities, development and implementation of patient navigation services and referral systems, access to financial health assistance, and making sure patient privacy and confidentiality exists. Institutionalization of the One Hospital Command, we would like to catalyze this as the National Patient Navigation and Referral Center. It aims to, one, the One Hospital Command Center as the implementing arm of the National Patient Navigation and Referral System. Second, we can have access to health facility information, meaning the HRH and bed capacity. Third, link patient and healthcare facilities to LGU and patient transport vehicles. Fifth is to provide financial assistance. We would also like to strengthen close coordination with public and private healthcare facilities, as well as to serve as an oversight to the regional patient national referral system. And lastly, for proper coordination with DICT and its existing resources that we can tap for this connectivity support. This is our way forward for the One Hospital Command Center to become the national patient navigation and referral system and pass as a law. And lastly, as we end this discussion, let me share with you a quote from Mark Hyman, that the power of community to create health is far greater than any physician, clinic, or hospital. Let this be a guiding hope to all, that with proper coordination to different sectors, we can make things or cities livable and resilient. Thank you, and maraming salamat po.
Thank you, Yusek Bong, for that enlightening presentation. There really is a lot of moving parts, no, that needs to be integrated and have everything work together, and then how it's all connected and made to work well together with technology. No? So quite a very challenging but enlightening presentation on what could be for the One Hospital system. Maraming salamat, Yusek Bong. We'd like to move on to our third speaker. If we can bring on screen, our third speaker is Mayor Vico Sotto. Mayor Vico finished his bachelor's degree in 2011, 10 years ago, with a major in political science and his master in public management degree in 2018 with honors, both from the Ateneo de Manila University. He was previously a project associate for the twin programs of the Ateneo School of Government, Government Watch or GWatch, and Political Democracy and Reforms, which is called PODER. He served one term as City Councilor for Pasig from 2016 to 2019, where he championed the passage of ordinances on citizen participation and freedom of information, with the latter becoming the first local legislation of FOI in Metro Manila. In May 2019, he won City Mayor of Pasig with a strong push for governance centered on people's participation and empowerment, transparency and accountability, and greater focus on education, housing, and health. Mayor Vico was one of our guests previously in our Livable Cities webinar, and I got to moderate that session. So I'd like to welcome back to our Livable Cities webinar, Mayor Vico Sotto. Mayor Vico, kumusta kayo?
Hi, Sir Sui. Magandang hapon. Thank you for having me.
Yes, and good to see you again. And maraming salamat for spending your afternoon with us. We'll bring up your slides now, and I leave you to do your presentation.
All right. First of all, good afternoon, everyone. To the other panelists, Dr. Usec Vega and Secretary Dayrit. We heard their very comprehensive, their great presentations. Hindi ko po matatapatan yung presentation ni Dr. Vega and Dr. Dayrit. So yung presentation ko po, it will be more of a taking you through the thought process of the local government, my thought process, the thought process of the local government as we face this crisis, as we continuously try to increase the capacity of our public healthcare system. So my presentation will not be so technical, but rather to just take you through the thought process that we had. Nakita naman natin yung presentations earlier, and we all know the problems and the crisis that we are facing, primarily because of COVID-19. You know, we started in 2019, before COVID, before all of this happened. We started in July 2019 with the idea or with the goal of promoting universal healthcare or shifting towards universal healthcare here in our local government unit. And you know, there are a lot of factors to this. We want to strengthen our primary healthcare system first and foremost. And this is a whole topic in itself, but as we all know, February, March of 2020 happened, and then we went to enhanced community quarantine. We started to see COVID-19 cases in our city, in our country, and a lot of our plans, to be very straightforward, to be frank about it, a lot of our plans were derailed, not only in healthcare, but really all of the plans and programs and activities that we had set. A lot of them were simply derailed, postponed, even canceled because of the pandemic. It's really changed the way that we do things. And crises have a way of exposing the weaknesses, as alluded to in the earlier presentations earlier. It exposes the weaknesses that we have. Zooming in on healthcare and our public healthcare system now, it revealed the lack of bed capacity. It revealed lapses in whether it's through administration or even the difficulties in the system of procurement, in the lack of human resources in our healthcare system, in our hospitals, in our health centers. That's what crises do. But the question is, what are we going to do given these crises? Are we just going to try to weather the storm and get out of it alive? Or are we going to use the crisis to actually get past it and become better and improve how everything is going? And so as we started with this pandemic, the thing is with this pandemic, wala naman po sa atin na nakaranas na nito. None of us have faced a pandemic in our lifetimes. As we saw earlier, the last pandemic was roughly 100 years ago. But 100 years ago, things were very different. We didn't have cell phones 100 years ago. Air travel was just, in its infancy stage. The way we travel was so different. Technology is so different. Healthcare was so different, and the technology that we have in healthcare, the medicines were different. And so it's not really something that can be, it's not very comparable. Ibang-iba po talaga ngayon. And so there's really there's no book that we can read, and there's no person we can interview that will really give us a very detailed or step-by-step approach. Of course, we can study the theories, we can study the science behind it, and we listen to the experts. We look at what has happened before with other outbreaks and other diseases. But the reality of the matter is this is new for everyone. And so as we started, we heard that there was a pandemic, and then it reached the Philippines. Even before we found out that there were cases in Pasig City, or even before COVID arrived in Pasig City, we wanted to take a very proactive approach. Now, of course, just a disclaimer: we understand and we know that the response of Pasig City and the LGU has not been perfect. It's been far from perfect. It's been a learning experience. Every day we find something that we need to do better. Every day we find a new problem that we need to address, that we need to fix. But we wanted to, really be out of the box in the way that we do things, and we had to be out of the box. We had to be creative, especially in the beginning. Again, precisely because none of us have any experience in dealing with a worldwide pandemic like this. It's really changed the way that we do things. And I have several pictures. If I can just share screen. Again, my presentation is not technical at all, but just sharing the experiences of our city. Rewind a little bit, and I guess this is why we're a little bit fortunate or even lucky, if we could say, because in 2019, the budget for Pasig City and our healthcare services was only at around 17% of the annual budget, because we wanted to work towards universal healthcare and strengthen the system in general. We increased this to 21% in 2020, even before we knew that a pandemic was coming. And so we're very fortunate that we made this decision. Now, the numbers that you see here do not even include some of the other COVID responses that we did, Ayuda, the funds from DRM, our DRM fund, Some of the PPEs that we purchased came from the DRM fund. That's not even included here. This is more of our health department, and our two hospitals. And then before COVID hit, we were trying to make everything goes smoother, learning from the problems of the past. These are service vehicles. This is pre-COVID. Baka magulat kayo, walang mask yung mga tao. We changed the way that medicines were delivered to the healthcare centers. We renovated our healthcare centers. Here's an example, with the limited space and the limited resources that we have, we tried to make do. And we actually renovated or started renovating all of our health centers before COVID happened. And so here, again, that's before COVID, kaya wala po kaming mga mask yan. And one of the most important things that we did, it's still an ongoing process. One of the most important things that we did was to really rationalize the HR of our health department. From the Pasig Health Office, it became the Pasig Health Department. And we actually created 1,502 new permanent plantilla positions. Again, revamping everything, creating or pushing for these really big reforms with the goal of moving towards universal healthcare. So again, while a lot of our plans were derailed or postponed or canceled because of COVID, thankfully we were able to do some things. Some were able to introduce some reforms before the pandemic started, and focusing on three major pillars of our healthcare system. First, we in the previous slide, the budget is very important. Kung wala kang pondo, wala ka din pangbayad sa doktor, wala ka rin pang gawa ng health center. But that's probably the least important part. The second one is the infrastructure, including IT infrastructure. A lot of reforms are being introduced there. We're actually in the middle of pilot testing a new IT system for our health centers, our barangay health centers, trying to integrate everything, try to integrate eventually even our hospitals. But the third one, and perhaps the most important component to our healthcare system, is our human resources. May pera ka, may infrastruktura ka, pero kung wala kang tao, baliwala lang ang lahat. And so we wanted to upgrade our plantilla, upgrade our healthcare human resources, and that's why we created 1,502 new positions, as well as the reorganization of all of our offices and units under the Pasig Health Department and our two hospitals. We've regularized a lot of our employees, tried to promote as many as we can. This is a picture of the personnel selection board. And then, as I mentioned, IT system. This is during COVID already. We introduced the Pasig Health Monitor, which includes the Pasig Pass. For those of you who have gone to Pasig or any major establishment in Pasig recently, you know that they require the Pasig Pass, which is a digital contact tracing solution. It's QR code based. It's very accessible, and it doesn't prejudice anyone, even who doesn't have money or smartphones, because you can just have a printed out QR code. So the Pasig Health Monitor, other than for contact tracing, we use it now for vaccination, but eventually we want everything to be integrated here and into Pasig Pass, which is a component of the Pasig Health Monitor. As we didn't have enough time before COVID to institute a citywide ID or a database of all of our data and our citizens, but sinusubukan natin humabol ngayon. We didn't have enough time. We were supposed to do our citywide census in March of 2020, but of course, as we all understand, ECQ happened, and so we were not able. But eventually, we want everything to be integrated. This is a great lesson that we learned from COVID. Hindi ko alam kung meron pang tumututol sa national ID ngayon. Dati maraming tumututol sa national ID, pero ngayon nakita natin kung gaano kahirap ang paggogobyerno sa panahon ng krisis, lalo na pandemya, na kulang yung datos natin at hindi buo yung mga database natin ng mamamayan. And as I mentioned earlier, this crisis is new to all of us, and as a mayor, there's really no other mayor I can ask, anong ginawa niyo nung huling nagkaroon ng pandemya? But we can exchange best practices as we go along. We continue to learn. One of the most major things that we did in our healthcare response and in order to increase the healthcare systems capacity in our city was to convert one of our hospitals, what is known as the Child's Hope or Children's Hospital, was to convert that into a COVID referral center. And at that time, this was a sort of a controversial decision, but we were thinking we want to, first of all, increase the number of beds dedicated to COVID. We want to reduce the risk of cross-contamination between COVID and non-COVID cases. We want to increase the capacity, not just in terms of beds, but overall of our hospitals to deal with moderate to severe cases of COVID. And so we did it. And then eventually we also established the Pasig Molecular Laboratory, where we do PCR and CLIA testing, and this really helped us to increase the healthcare system's capacity. But again, at the time that we decided to do this, we didn't know 100% if it would work. We didn't know that it would be we weren't 100% sure that it would be a great decision, and really that's really a big lesson for all of us in the middle of a crisis, that especially a crisis that's new to all of us. We have to accept the risks, but we can't just sit idly by and just hope that we go into the right direction. We have to be bold, be brave, and make decisions that might not necessarily be correct. We might be proven wrong later on. For instance, but always with the mindset of, we have to think outside the box. We have to push the envelope forward. We have to do more. We have to do better. And just one instance, this COVID referral center, this proved to be the right decision. But we also did things, and we decided on things, and we implemented certain things, and we made decisions that proved to be wrong later on. For instance, when it comes to sanitation and spraying everything, in the beginning, we saw that they were doing it in other countries. We couldn't wait for better studies to come before we decide if we're going to do it or not. So we looked at our resources, and we said, okay, we're going to buy sprayers, the knapsack sprayers, and then we have unmanned firefighting vehicles. Let's use that. Let's spray the schools. Let's sanitize the schools with the chlorine solution or whatever they use to decontaminate everything. And eventually we realized, and the experts said that this might not really be a great idea to just spray everything, even people. In fact, the DOH has said, later on, the DOH said that you're not supposed to spray people, but we didn't know that early on. But again, we were willing to make decisions, and we, in the middle of a crisis, we need to make decisions that we have to accept that maybe after a few weeks, after a few months, or even after a few years, we may be proven wrong. But again, we can't just sit down and do nothing and not take risks. We have to be willing to take risks, think outside of the box, be creative in the solutions that we forward and implement in our city. As I think was mentioned earlier, we're not just thinking about COVID response here. Yes, right now, that's the primary concern, the primary consideration for just about everything that we do, because we're in the middle of a worldwide pandemic. If we don't get the numbers down, get the COVID numbers down, then we can't get back to our lives as we knew it before, or even the new normal for that matter. But we're also thinking long term. We're thinking of universal healthcare. We're thinking of continuously increasing our healthcare system's capacity, not just for COVID, but in general, for non-COVID as well. And in order to do this, we need to continue pushing. We need to continue instituting reforms. We need to strengthen. Paitingin ba natin yung mga reformang yun? And let's be willing to take risks. I think that's one of the most important things that we've learned in this pandemic, in this crisis, that we have to take risks and we have to keep pushing forward if we want to reach a better normal, a better new normal for our country. So that's it for me. Maraming salamat po. God bless po, and good afternoon sa ating lahat.
Thank you again, Mayor Vico. Very enlightening and inspirational talk that you gave. You made some very good and impressive points on the pillars of the health system. No? Like, amazing how you were able to make, even pre-pandemic, no, make the decisions to invest on the pillars. No? Yung budget was was increased to 24%. All of the investments in IT and physical infrastructure. Also, yung 1,502 new positions, the people who got regularized in their jobs, no, really investing in the people who make the healthcare system possible. Napakaganda ng sinabi mo that although wala tayong guidebook kung paano to deal with this health crisis, you know, yung binanggit mo how to, you need to be creative, to be bold and brave so that you can do more and do better. These are really great and very inspirational points that you mentioned. Thank you for that. We have lots and lots of questions from the audience. Napakadami na siya. Continue to voting up the ones that you like and sending us more of those questions. We have more than 400 people watching us live now. So magandang hapon po sa inyo lahat and thank you for joining us in this webinar. We have a guest from Globe. We invited Michael Agustin, the sales director of Globe Business, to highlight a few key takeaways from our three presentations. Si Mike is a highly experienced executive with over 23 years of professional experience in the telecoms industry under sales and engineering. Prior to his current position, Mike served as Globe's cluster head from 2018 to 2020, responsible for retail and manufacturing industries and responsible for the BPO industry and local service providers in the country. So to take us through some of the key takeaways and perhaps tell us about how Globe is responding or helping in making better health systems. Let us all welcome our guest, Mike Agustin. Hello, Mike. Magandang hapon.
Hello,
Welcome.
hi, magandang hapon, Sui. And thank you for inviting me and Globe again to participate in the Liveable Cities Challenge. And first and foremost, very nice and good insights from our guests today. I'd just like to take everyone on some of the key takeaways from what they shared earlier. So starting with former Secretary Manuel Dayrit. He talked about, well, it was very informative in a way. He took us through, what the virus is, and how it can easily, propagate inside, the lungs and the body of an infected person. And he mentioned a lot of things on how the capacity of each one enablers, like for example, government and private providers and of course the people are involved in this, and how we can maximize some of those capacities. He talked about how we need to bring together all the cultural knowledge and social competency and technical competence of each of these segments in society. So I guess there was a call to transform the health system of the country, coming from the gaps and the challenges that was mentioned, but that was revealed in the by the secretary. I think what we wanted was to put all the elements in governance and facilities and data gathering and of course the human resources all together to be able to come up with that transformation in our health system. And we need to be proactive. You mentioned us to be organized as well and having to maintain that system over time so it can be sustainable for everyone. Also, he mentioned that that the battle with COVID-19 is not over yet. We experience surges and different waves of the virus. So we need to continue to test, trace, and treat as we improve our health system as well. In order to protect the lives and livelihood and even the economy to continue to flourish and recover. At the same time, I'd like to quote him in what he said. Our health system response must be equal to the viral threat. And in the end, he mentioned the long-term response is, of course, vaccination. And that has been the advocacy of most of the LGUs for their constituents. From Undersecretary Leopoldo Vega, he mentioned a lot of the things on the capacity as well, no, and some of the challenges that each of the every one of us, no, people in government, no, also faces, no. And one thing, key takeaway from the presentation of Usec Leopoldo Vega is on the role of ICT and technology, and he mentioned that ICT plays an important role in finding a solution, in helping finding a solution to the current crisis, no, so as to be able to sustain and enable the other actors, no, in resolving the issues or the pandemic, no. So he take us through the idea, or at least what the government has done, no, in the One Hospital Command Center, and he mentioned, the need to be connected at all fronts, at all levels, no, from the people, human resources, governance, and the capacity, and even ICT. Again, mentioned ICT, no. And thank you for lobbying, no, in with our lawmakers, no, in able to institutionalize the One Hospital Command Center, as as shared by the Usec, no, has become very effective last year. So we want to continue that and make it more well, institutionalize the One Hospital Command Center. And also he also mentioned, as part of that One Hospital Command Center, is instituting a national patient navigation and referral system. So I guess that would be the backbone in enabling our citizens, our people, to be able to maximize the system of the platform for against COVID, no. And lastly, Mayor Vico talked about a lot of things. So even mentioned this earlier, that even prior to COVID, they already made changes in the city, as far as renovating and rationalizing some of the budgets, and even setting up the organization, for the health department, So I guess that's one part that we can put together and integrate later on, to whatever transformation the national health system may take form, no. So Mayor Vico also mentioned, having a Pasig health monitoring system that they use for contact tracing, and later on, or being used right now for vaccination, no. And and also you mentioned the COVID referral center, no. I guess that would be similar to what the Usec mentioned earlier, no. To be able to increase the resources around, from beds and lowering risk, and having more people attending or combating, COVID, no. And lastly, and I guess he mentioned about making bold decisions and taking risk, no, and whatever those decisions, no, the most, no, they have attended or responded to the needs of the people, no. So that's thinking outside the box. So thank you and congratulations to that, Mayor Vico.
We're gonna flow through to our panel discussion now. Great, we have plenty of time to ask the questions from our audience. Meron tayong mga top-rated questions here. Thank you for using the voting feature of Zoom. We have a top-rated question here, and it comes from Sir Dinky, who's on screen right now. So Dinky Von Einsedel is our friend from Liveable Cities. He works with us a lot. Your question, Sir Dinky, top-rated question for this afternoon. Please go ahead. We'll put you off mute, and you can ask the question to our panel.
Actually, Sui, I asked so many questions, I forgot already the first question that I asked.
The first question is that 22 people voted on this, maliban sa inyo. It says here that this question is addressed to Dr. Manuel Dayrit. Your presentation highlights the importance of data on the factors that impact on public health. In what office of the LGU should the data bank be located and managed? Top-rated question. So, Dr. Manuel, maybe you can give it a shot.
Well, there are two components to this. One is if it's epidemiological or disease surveillance data. It might be housed in the epidemiological unit of the LGU. So these are people that are actually in disease control and are monitoring the disease surveillance in the city. Of course, depending on how extensive the data is, because you could actually have management data and not just disease control data. You could have that at the city administrator's office. Okay, but the idea is if it's a surveillance system for diseases, and these are reportable diseases, then you give it to the people that are in disease control so that they can analyze it and they can advise the mayor and the city administrator accordingly. For example, if you're monitoring whatever, rabies, okay, dog bites, and you're looking at that problem in the city, you could be alerted by the number of cases and then you could act accordingly. So this would be, I think, the answer to that question.
I have a question here for Usec Bong. This is from an anonymous attendee, one of the top-rated ones. No, I'll ask you two questions, Usec Bong. No? The other one is actually from another attendee. But the first question goes, and these are related, no, to Usec Bong. How is the National Patient Navigation and Referral System integrating with cities and hospitals? That's one question. But this related question comes from Roxanne, and it says here, Dr. Vega, are there plans to bring the One Hospital Command Center and its services to the regions, and how does this complement the current practices of hospital service delivery?
Thank you, Sui. In fact, those are really related questions.
Yes.
One is the National Patient and Navigation and Patient Referral System, and this is really the way forward in terms of the One Hospital Command in institutionalizing this with as a law. In other words, this will actually be the navigation center for all the citizens who would need access to healthcare, access facilities, and even financial aspects. Now, because we will definitely tie up with the different hospitals through a telecommunication network. And the second is how do we plan this OHCC in the regional levels? We are actually doing it now. And we are actually serving as a template of how we will proceed on a national level. So in other words, we are now moving towards the regions and establishing the One Hospital Command. Especially when we saw this pandemic, we had to make sure that we can easily coordinate with down to the regions on the number of vacant beds or even isolation facilities that they have, and even testing centers, so we can actually make sure that the patients are given the proper referral. So we are actually establishing right now regional One Hospital Command, most specifically in Region 3, and we started with Region 4A and down to the south, wherein we have Incaraga and Southern Mindanao right now. And we do hope that with the next few months and with the proper coordination with PLDT, since we are definitely would like to have something like a hotline for all of these regional commands for easy access to the different hospitals, then we will be able to do so. But right now, we are really working into ways on how best we can make a patient navigate through all our services easily and with easy access and information to all the facilities that we have. So that's our very goal.
Thank you, sir. And then maybe related to that, I mean, let me ask this question to Mike. No, this is a question from FB. What has Globe done to support our health system? Maybe related to yung binanggit ni Usec Bong, no? Were you involved in the One Hospital System? But what other ways did the Globe get involved in helping address the health systems and of course fight the pandemic?
Before Mike, can I answer that, Sui? Because
yes, sir.
I would like
yes.
to give special importance to Globe right now, no? Because when we established the One Hospital Command, we didn't have any kind of communication really. In fact, we were just adopted by the MMDA, and Globe came out with a lot of the support for us, especially with the cellular phones and even the direct lines, and that proved helpful in our first wave. And in the second wave, we were just overwhelmed, so we really had to address more.
Yeah.
Thank you.
So
Thank you
is
for
the is the one hospital command still at MMDA, or yung photo at PICC is the
Now,
current location?
we have expanded ourselves. We have expanded our telecommunication network. In fact, Globe is still there, together with the other telecommunications, making sure that we have more lines, and we've expanded the facility to the PICC. It's a big meeting rooms, 2 meeting rooms. We have now our people working there now. It's about 80 agents that actually can receive and coordinate the calls. And more importantly, we're opening up the telemedicine or the virtual consultation that can be done free for all. No, anybody who would like to gain access to our network.
Great, thank you for that. Mike, I think some part of the answer was already mentioned by Usec Bong. Can you add on to that or build on to that response?
Thank you, Usec, for well, the One Hospital Command Center. So Globe was part of it initially, from last year, and still continue to support the One Hospital Command Center. In other aspects, so we also roll out different services to the hospitals within Metro Manila and around the Philippines. So like, for example, we provided Go Wi-Fi, that's internet access, to about 124 hospitals around the country. So the most recent one that we put on air was in Antipolo, where 2 hospitals were well, we turned on the Go Wi-Fi for the 2 hospitals in Antipolo. That's the most recent one. And aside from that, of course, we're very heavy in working with the LGUs as far as our services under Consulta MD. So this is telehealth medicine that we promote to the LGUs and to the rest of businesses as well, because it's a teleconsult system wherein people, even those afflicted with COVID, they can do triage over the phone. They can give clearance, for example. So to help as well the hospital system, so they don't especially when the hospital systems are overwhelmed with patients. So this one they can do over Consulta MD. And other than that, of course, we have GCash that we use for contactless payment, or even other financial services that people can use, so they don't have to use money or using money in paying off some other services. And other things, like for businesses, like in the height of COVID last year, we provided internet services to work from home employees in the BPO sector. So we deployed at the height of the pandemic about 60,000 at one time in these different BPO companies to enable their employees to work from home. So there's less contact. And those are the things that that's what we've been doing to businesses and of course for the health system.
Thank you. That's a really great, very concrete examples. Thank you for mentioning that. But let me ask this question plus another question. Let's do a combo. This is from Rongel Delphine. What are the possible post-recovery plans of Pasig? So that's one. And also a related question is, what are the longer-term health programs being implemented by Pasig so that we can have more healthier and stronger Pasigueños now and in the future?
The answers to the 2 questions are pretty much the same.
Correct.
Right now, we're trying to transition toward a healthcare system that's not just COVID. Although we didn't stop, hindi naman porket may COVID ay nawala yung mga may sakit sa puso, may cancer, etc. But we have to admit that with all our focus and resources for COVID response, and some other aspects of the healthcare system were really sacrificed. Pero yun nga yung iniiwasan natin na magpatuloy na ganun. And so, for example, our children's hospital, before the surge, we actually transitioned to open the OPD and yung pedia department. Thinking a little bit more long term, of course, it's going to be the implementation of universal healthcare. And the most important part of this is really strengthening our preventive healthcare or primary healthcare. So it's really strengthening the barangay health centers. By July 2, we're actually going to launch a new IT system that we're going to use. It will be integrated with the Pasig Health Monitor. Most people are familiar with the Pasig Pass because that's our QR code. But all the information there will be integrated. Of course, following data privacy law. But I think this is very important because as we move towards this new normal, we really need to strengthen our primary healthcare. A lot of the weaknesses of this has been highlighted during the pandemic na may konting sakit, diretso sa ospital. Dapat sa health center muna. A lot of the minor illnesses and symptoms can be dealt with at the primary healthcare level or at the barangay health center level. So you need to build the trust and confidence of the people with our barangay health centers as well para ma-declog din at ma-deload yung mga hospital natin. So, a lot of this, I mentioned the rationalization of our healthcare system, getting more people, improving our human resources, capacity building, the tech or IT infrastructure, physical infrastructure. I could go on and on, but the bottom line is we need to keep improving the system, introducing things like, or maybe not introducing per se, but strengthening certain things like yung no balance billing natin. Dapat wala na talagang babayaran kapag mahirap. We're able to do this successfully now with our COVID referral center. People who are admitted, especially Pasigueños who are admitted to our COVID referral center, they don't pay anything. Dapat kahit gamot, as much as possible. Minsan nauubusan talaga ng gamot, pero as much as possible, wala silang babayaran. PCGH, yung General Hospital, yan din ang project natin sa ngayon. It's not there yet, but we're getting there slowly.
Thank you for mentioning, especially those forward-looking programs for the city, Mayor. No? Pati, I understand there's also a Malusog na Batang Pasigueño program. Diba? That's even looking at taking care of children so that they'll be healthier.
All of our students from K to 12, they receive nutrition food packs with vitamins. I think yun yung isa sa importante din. Kahit masipag yung bata, kulang yung sustansya sa kinakain niya. Masa-stunt talaga yung development.
That's very good. Very interesting and inspiring stuff. I know Dr. Manolet is listening intently here. I'd like to circle back to our first speaker. Let's get the bookends connected. See, after all the things that Mayor Vico has mentioned, how can you connect all of these best practice sharing, yung mga current and even future programs na pinaplano around Pasig City, and also perhaps yung the new systems that are in the that Usec Bong Vega mentioned. How does this all connect to the conceptual top tips that you mentioned earlier this afternoon?
Well, I think they connect a lot. If you listen to what Mayor Vico is, he's actually strengthening many of the components of the health system that we mentioned. Infrastructure, for example, financing, the HRH. He's connecting all of that. And he's also connecting it to non-health, strictly health concerns like education, nutrition for the children. So I think all of that is connected. And therefore, I think as we speak, he's already strengthening the health capacity of Pasig. I think just putting 1,000 people in the plantilla, that's a huge move.
Yeah.
Okay, because that means that you have more people working in health. I think the issues really now would have to do with what are the other cities doing as well. Okay, because and this is where the interconnectedness between cities and for example NCR, you move, it's seamless, it's almost borderless. And really what you really want over the long term is that all Filipinos, regardless of where they live, get the type of health services that they deserve, okay, or what the government can give. And eventually, you don't like a situation where some cities are doing better than others. Okay, then because then you see what I mean, diba?
Yeah, yeah.
You want also a sort of a standardization of all services at a very high level.
Mm.
So this is then a question for how do you do that? And how local governments work with national government in order to do that. There was a question in the chat box about, would you favor recentralization of hospitals? Okay. That's not only a technical question, that's a political question. Because if you really were nuancing your planning and your policy making, you would probably make distinctions and manage it in a way that where you had provinces that were very weak, because very poor provinces practically have no resources to run their hospital. Okay? So would you then work in a way so that you strengthen those places, over a period of time, eventually hand them back, when the province is stronger. And for provinces and cities that actually already have their act together, that have resources that actually feed into their operations, then, it's a question of how you network that with all of the other cities that are in the immediate vicinity. So this is all has to do with the governance issue. And when you're looking at the governance of the total system, both national, even as you have people looking at it at the local government level. And I think that's essentially the secret. That's the secret of countries where they've been able to, you might say, have a seamless governance across national and local government levels, and are able to nuance this because they have information at hand.
Good. Yes.
A government that can see, cities are doing better because they have the metrics for health in those cities, and cities that are not. That's, their role is to try to lift those cities that are not doing as well.
Thank you, sir. Good point. Let's open the floor. We have about 13 mayors that were or are in our webinar today. We'd like to invite them to come forward, raise their hand, ask some questions to our panel.
So we maybe at this point while we're waiting,
Yes, sir.
Itong livable cities, you actually already have a database. You actually have parameters for each city.
There is a livable cities dashboard.
Right, you have a dashboard. I think what we could work towards, and I'm told that there are no indicators that are agreed upon globally. But we have indicators for resilient cities, for example, in various sectors, and you can have your indicators for a public health system.
Yeah.
And then see if you could collect data across all of the cities. And then, work out a score for these cities. And it's really not meant to judge them, but a way of being able to compare and to help out wherever you can see gaps and where you can see, cities advancing or lagging behind.
Correct. It's a good way to benchmark to help performance. Oh, by the way, we're joined by one of our Suki. This is architect June Palafox. Who's going to raise his hand and bravely will ask a question. Architect June, how are you today? Good to see you again.
Fine, thank you.
Oh,
Thanks
it's good to see you. Thanks for joining our webinar and
thank you, sir.
Volunteering to ask a question. Please go ahead and ask a question.
Yeah, at the rate we are doing the vaccinations, it might take 5.5 years to 10 years. And we've been donating our architectural design services for the mega vaccination center that can vaccinate 10,000 people a day. And at the start of COVID last year, we donated designs for converting the 44,000 barangays covered basketball courts. They can have isolation rooms for 32 patients and clinics and so on. And 5 continents that gratefully acknowledge our free design. And I don't know it's being used here. We send it to the Office of the President and Department of Health as well. But the mega vaccination centers, Department of Health, Department of Tourism, and Office of President are supporting it. So we need more vaccination centers. And the ones we're using now, doctors tell us they can even spread the virus because they are small tents, air conditioned, supposed to be natural air. That's one. And then our research also, correct me if I'm wrong, Dr. Dayrit and Dr. Paul, their secretary, with our population, we need at least 5,500 hospitals. We have less than 2,000 hospitals. And as the population increased, like Metro Manila, the open spaces were sold, decreased. Elsewhere in the world, like Singapore and European cities, as the population increased, their open spaces, the lungs of the city increases. And we talk about prevention. Even Hippocrates, Nurse Nightingale, the planner of the Central Park, New York, they tell it's prevention. And our American Institute of Architects and international meetings, the advice now to architects, all our buildings should be designed like healthcare facilities. And we're doing that now. Maybe you could even influence the building code. Like with the lack of open spaces in Metro Manila, maybe we require now sky gardens. So we have more lungs of the cities. And when we have 7 million population in Metro Manila, we had more open spaces. Now that we have 10 million to 14 million population a day, we have less open spaces. One city, I will not mention anymore, 600,000 population. They only had 20 ICUs. So maybe the Department of Health might have this information, but the private sector has it. Liveable cities, they must have it. Then we're doing also plans in several cities. And also share best practices. Like in Dubai, they used to do the vaccination centers in the World Trade Center. But the vaccinists, they don't leave their chairs. They complain of other diseases, other illness. So Sheikh Mohammed of Dubai, he relocated the vaccination centers to shopping malls. So 10 minutes, less than 10 minutes, while waiting, mag-shopping ka muna, kumain ka muna. So I spoke to SM malls. They're making available nationwide 75 malls to LGUs. I don't know if they are takers. So even the basketball courts, if designed properly, it can vaccinate, I think, 3,000 persons a day. A high school somewhere in Metro Manila, only 300 persons a day. Kasi yung classrooms, they're good for elections, but they're not good for vaccination. And thank you, sir, for allowing me to share. Thank you.
Thank you, sir. Thank you, sir. So no question, but good points that you mentioned, Architect June. It's good to see you today. You're looking good.
Thank you, sir.
Mayor Lani, hello. Magandang hapon sa inyo. It's good to see you again. And welcome
Yes.
back to the Liveable Cities webinar.
Yes, very interesting afternoon. I've been listening all throughout the webinar. I'm very much interested in the integration of Antipolo City, Pasig, Valenzuela, like Mayor Vico has mentioned. Like in our city, we have also a system which we call the Barangay e-governance information system, where our constituents register for vaccination. They register, but it's not integrated with the Stay Safe system, which we have adopted. Kasi magkaiba sila totally. It's not really integrated. So is government doing something through DICT or whatever technology there might be? After the vaccination, do you have a person holds several QR codes for your vaccine, another QR code for once you enter all your buildings? Kasi like in our case, in the city of Bacoor, my MIS would tell me, "Ma, mas okay yung Google Meets kasi natitrace natin kung saan pumupunta yung constituent natin, kung saang department nagpupunta. Pero sa Stay Safe, limited lang yung information na nakukuha natin. Paglabas ng building, hindi na natin alam kung saan siya pupunta."
Mayor Lani, we have Mayor Vico raising his hand just now.
Hi, Mayor Lani. Actually, that was also a very similar question and problem that we had. As I mentioned earlier, meron din kaming sariling app. Just like you, we have our own system. But we've actually, to the help of our developer, we've actually connected it to the system of Stay Safe. Integrate po namin sa kanila. That's number one. And then number two, what we're working with NEDA now and the Asian Institute of Management to integrate other aspects of it. So yung Stay Safe saka yung Pasig Pass, yung contact tracing data, it's integrated now. Although hindi pa siya naka-on, but the system is actually integrated. Hindi pa siya naka-on. I think Stay Safe has some issues. Maybe the Department of Health would know better. But other than the contact tracing data, we actually integrated Pasig Pass to the CDRS of DOH. So ibig sabihin yung testing, pag once na-test na at nasa database na ng DOH yung test results, PCR testing, automatically nafa-flag na yun sa amin. And then we have the automated contact tracing SMS system now through NEDA. It was actually mentioned sa IETF resolution, but yung point ko lang naman is that it can be done. It's a little bit of work sa side ng developers, pero kaya naman po i-integrate. Kasi parang nakakatawa naman kung isang mamamayan tapos 4 yung QR codes niya. Kasi
Yun nga eh.
natira siya sa Bacoor, nagtrabaho siya sa Pasig, pupunta siya sa Mandaluyong. So maganda po talaga ma-integrate natin. It can be done, medyo matrabaho lang sa IT side.
Siguro I would suggest if national government should simplify the system, kasi like kami LGU may kakayanan kaming pumili kung anong gusto naming system, but it's not similar to what Pasig is doing, what Muntinlupa is doing. Sana isa na lang na integrated system.
Right.
So at least we're purchasing, we're devoting our budgets to the right system, kasi sayang naman, sorry LGU Bacoor, mali yung system nyo, i-adapt nyo yung system ng Pasig. Ito yung pondo niyan. So totally scrapped off yung pondong nila. Ang sayang yung pondo. So I just don't know how it's going to be put together by government. I know Stay Safe has been integrated to the whole system. Siguro it's just a matter of giving us the direction on what system really works at this point in time, para hindi naman masayang yung pag-aalat namin ng funds for this particular situation.
Any chance that this is being discussed at the national level, Usec Vega? Or
Yes, Mayor Lani, good afternoon po, and Mayor Vico. In fact, the Stay Safe has recently been accepted by the DILG, and it took some time really. First, they wanted to host this in the Department of Health, but there were a lot of issues and concerns with the Department of Health that it took so long until finally it was logged to the ICT, to DILG, and DILG actually took hold of this. And where we are right now is that together with the ICT, I think sa Pasig, I remember very well, they tried out with NEDA, si Secretary Carl, in terms of making sure that the IT of Pasig can easily integrate with Stay Safe, and roughly also integrate with or sync with the CDRS. Kasi yung CDRS is a very key component to determine whether there are actually positive and negative ones around your vicinity. So where we are right now, it's the DILG now is moving forward for, actually they have accepted it already. It's only very recent. And then they're trying to improve on the flaws of dito sa Stay Safe. So the thing is they would like to synchronize or integrate all of the apps that we all have, so that we will have one integrated app through Stay Safe, so that everybody can use that and also determine through contact tracing on who the people are with negatives and the positive. So it's with the ILG, Mamlani, and it's also with the DICT, who's also trying to push this, because honestly, it has really lagged. It took some time, and it was only very recent that Pasig with NEDA, spearheaded the integration of this, so that it can be used by all local government units.
So is it safe, Usec, Doc Vega, that we coordinate with NEDA so they could teach us or probably help us in integrating our systems as well?
Yeah, it is with the DILG, Mablani, and it actually NEDA was actually just making a point that through the piloting it with Pasig, that they can easily integrate this their information technology with CDRS, which is actually the data bank for all patients, and also sync this with Stay Safe. So DILG is working on this, and of course through DICT.
Thank you.
Salamat po. Thank you, sir.
Thank you for that, Usec Vega and Mayor Lalin, Mayor Vico. Alam mo, these types of connections and getting people talking makes us feel that we're really fulfilling our purpose as in the Liveable Cities webinar. So maraming salamat for all of those candid and very enlightening conversations. We are at time now, and I'd like to thank you, dear panelists and people who have asked questions for all of your time. Our closing remarks will be delivered by Ms. Veron Gabaldon. We'd like to bring her on screen for the closing remarks now. So, Veron is the Executive Director of the Philippine Disaster Resilience Foundation, or the PDRF, the major private vehicle and coordinator for disaster management. As Executive Director of PDRF, Ms. Veronica Gabaldon leads the strategic direction, the programs, and the administration of the organization towards achievement of PDRF's vision to build the resilient businesses and communities in the country. Recognized as one of the active women leaders in the DRR community in the country, she led the design, the launch, and the operation of the country's only private-led operations center in Clark, Pampanga. As a strong advocate of the way private sector engages before and during crisis, she has been an active in the Connecting Business Initiative platform of the OCHA and UNDP, where she shares her expertise and experiences. Before being appointed as ED, she acted as PDRF Senior Program Manager, leading the recovery program and the telecommunications cluster. So let us all welcome Veron to do our closing remarks. Hello, Veron. Magandang hapon.
Hi,
Good to see you.
Sui. Good afternoon, and thank you for that gracious introduction. This pandemic has clearly put a spotlight on our healthcare system. And in this afternoon session, we have unpacked the challenges that we are now facing. But at the same time, we were also shown a roadmap we can look into to build the resilience of our public healthcare system, even going beyond our pre-COVID state. Unlike in the time of Spanish flu, we are in the modern time where technology plays a vital role in fighting this pandemic. It is important to harness this capability in an efficient and innovative manner. Sharing in the spotlight are our local government units leading the fight against this pandemic. And to stay on top of the situation, agility in leadership and management of the city's healthcare system have become essential. I also would like to share or to put a spotlight, or our third spotlight, on a public and private sector collaboration. And an example of this is the Task Force T3, where the private sector have been providing support and working alongside the government in different initiatives to fight this pandemic. And we can further elevate this into a whole of society approach and actively engage multi-sectoral stakeholders and facilitate their active participation and hold dialogues to address socio-economic and livelihood issues brought about by COVID-19. This pandemic may have forced us to distance from each other, but technology has brought us closer together to learn from each other and share best practices. That is the objective of these Liveable Cities webinars, and I especially thank the local government executives who have been attending our sessions. Please continue to share all these valuable informations, take note of actionable measures you can adopt, and establish your own whole of society approach in winning over this pandemic. Our organization has a number of initiatives, and these initiatives are aimed to help strengthen the capacity of the healthcare sector through capacity activities ranging from webinars, mentorship programs, and self-paced e-learning courses on the digital platform iAdapt. Signing up to iAdapt is free, and there are several courses that users can take online. The first webinar with Brown University, focusing on the science behind vaccines and combating vaccine hesitancy. We also have free online training courses on COVID-19 tools for contact tracing and data management made in partnership with DICT, DOST, and DOH. Project K3 is also conducting a public service continuity mentorship program for both local and government hospitals with a focus on health resilience. We also highly encourage everyone to avail of these free courses where they can each earn DOH recognized certificates and CPD units for professionals. Thank you very much for attending this afternoon session, and we hope to see you in the next one. Maraming salamat po.
And with that, we draw close. We close our webinar. Please follow us on social media so that you can stay tuned to the offerings of the Liveable Cities Lab. This is you can also contact us through the email, Facebook, Twitter, and Instagram, and also on LinkedIn. So with that, maraming salamat sa inyong lahat for spending your afternoon with us, and we wish you all a good rest of the day. Thank you.